Hello and welcome to World Insight, coming to you live on CGTN from Beijing. I'm Tian Wei. We begin with the ongoing G20 Health Summit in Rome. The summit is set to endorse a Rome Declaration for Principles, which is pitched as a guide for global cooperation in dealing with future health crises. Chinese President Xi Jinping delivered a speech at the summit via video link from Beijing. She said that China will provide an additional $3 billion over the next 3 years in other developing countries to support COVID-19 responses and economic and social recovery. He also calls for improving global disease prevention and control system.
China will provide an additional $3 billion in international aid over the next 3 years to support COVID-19 response and economic and social recovery in other developing countries. Having already supplied 300 million doses of vaccines to the world, China will provide still more vaccines to the best of its ability. China supports its vaccine companies in transferring technologies to other developing countries and carrying out joint production with them. Having announced support for waiving intellectual property rights on COVID-19 vaccines, China also supports the WTO and other international institutions in making an early decision on this matter.
Well, with the Global Health Summit, what are the prospects of a consensus on dealing with the pandemics, particularly the vaccines, and also the future road ahead? Let's ask our panelists. In Providence in the U.S., Dr. Megan Ranney, emergency physician from Brown University. In Seattle, also the U.S., she's originally coming from South Korea. Dr. Alice Kim Kyung-tan, internist at the Ms. Medi Women's Hospital. And last but not least, in Nanjing, Wu Zhiwei, director of the Center for Public Health Research with the Medical School of Nanjing University. Ladies and gentlemen, welcome to the program. Now, with the Global Health Summit and all the speeches delivered by the global leaders, are you more optimistic about the prospect than before the summit, or remain the same? Let's have the temperature check first. Dr. Ranney.
So I'm a little more optimistic because when global leaders state their commitment to collaboration, both in distribution of vaccines and in supporting populations around the globe in recovering from the pandemic, once they've made those public statements, they kind of have to follow them up. But the proof is going to be in the pudding as to whether they do follow through and to what extent they provide both funding and technical support.
Pudding, funding, support. So let's go to Dr. Kim Kyung-tan from South Korea. What about your temperature?
I am more optimistic currently. I think today's event was really an opening act for the upcoming World Health Assembly, which will be held from May 24th to June 1st. And I think that's when the concrete steps for how to get over this current pandemic, prevent future global health crises, and make our world a healthier, more equitable, sustainable place. I think that's when the nitty-gritty work will be done. So I'm glad that today's health summit occurred. I think that there is much more work to be done, however.
Dr. Wu, what about for you?
Yes, I'm actually pretty optimistic and pretty encouraged as well, because if you look at the current situation of the pandemic, we are at a critical point that we need to have an international community to unify and also act in coordinated manners, because once we have vaccines, we need to utilize those vaccines in the needed countries and the areas basically trying to pull down the virus. Otherwise, when a few countries have the virus under control, then you won't be able to solve the problem of rebounds. That's what we have seen in the past is exactly the same pattern. So the political leaders come together, build up the trust, and then evenly distribute the vaccine. I think it's very critical.
Well, they at least are talking about it right now. Whether that will be translated into actions, we'll have to wait and see. But talking about actions, there has to be ways in order to really act. We see it on multilateral platforms, such as with WHO. Well, WTO also talk about the patent issues related to the vaccines. We also seen it in a bilateral way. For example, China and some of the other countries, the European Union, some of the other countries, even between Africa and the European Union. But the thing is, which works and how it works now. Dr. Rani, I want to ask you about the WHO ACT, which is an accelerator focusing on vaccine, research and distribution, tests, and medicine as well. We are still more than $15 billion short of funding. We are not seeing much a commitment this time from leaders. So really, multilaterally, what is the state of the reality?
So I think that we're facing a bunch of different issues. We have COVAX, we have ACT, we have each individual country's investments to create effective vaccines. Those are all competing right now. What I would like to see is I would like to see the world unify on a single platform to help get the vaccines that have already been developed out into arms.
What is that single platform that you are referring to?
So COVAX is a great platform right now. If each country committed to donating money and or doses of vaccine to COVAX to deliver to the countries across the globe, that would be transformative. And they've already demonstrated through Gavi that they have an ability to work together multilaterally, that they have the buy-in of low and middle income countries. Why go and recreate the wheel? And yes, we need to invest in creating more new vaccines, but we have vaccines that work. Let's use these and invest in increasing their production in the short term, because now is the moment where we need to fight this pandemic.
Did I understand you right?
We're still going to need stuff a year from now, but we need to do things today.
Did I understand that right? Their understatement there seems to be, why the ACT accelerator of WHO compared to COVAX? Is that what you're trying to say?
That's correct. I see the ACT accelerator as being an important long-term strategy, but COVAX for now has the capability to help stop the pandemic in the short term if we invest in it adequately.
Okay, interesting. Now, there are a lot of debates. This is one of those. But if you look at COVAX, Dr. Kim Kyung-tan, we understand much of the COVAX vaccines to be distributed should be produced in India. But now, with the situation in that country, unfortunately, we're not seeing the delivery of that. And therefore, the COVAX platform, despite the credibility it has had, China including giving credibility to it as well, we haven't seen it delivered its promises. So there seems to be a whole chain of issues related to COVAX right now. Dr. Kim Kyung-tan.
Exactly. So because of what's going on in India, unfortunately, there are many countries that are wanting and waiting for vaccines. I think what you're addressing now is the issue of scaling up manufacturing. Right now, we think that it's going to take 6 to 9 months for us to have manufacturing up to the scale that we need to fully vaccinate, or even try to fully vaccinate 20% of the world's population. One of the ways that we can get around this is through contract manufacturing of vaccines. I think there is a lot of manufacturing capacity that has not been tapped into in middle income countries. South Korea certainly has a lot of biotech and pharma resources that could be used to make more vaccines. Of course, our SK Bioscience manufacturing plant is kind of taking up the slack of making more AstraZeneca vaccines, but there are other biochemical companies, pharma companies that can really be put in the game to help end the pandemic. But what we need is technology transfer, we need know-how transfer, we need raw materials and the supply chain to be sustained and guaranteed and protected. And these are all things that both the WHO and the WTO need to work together, including all of the world head leaders. They need to get together and make this happen because, as Dr. Rani said, we know which vaccines work. That's not a mystery anymore. We know which vaccines work. It's just a matter of manufacturing to scale and delivering them to the people who need them.
Dr. Tan, though, I want to remind you about the debate that is already taking place quite some time, that the United States government, this administration volunteered to have this patent waiver of the vaccines. However, the manufacturers who are really having the patent of these vaccines do not want to have a waiver of the patent, which means the politicians' promise actually ended up empty. So this is a very interesting issue. Meanwhile, you also see different opinions from the European Union, from China, from some of the other countries. So this is a very interesting story as we speak. Dr. Wu from China, what do you make of that? The early two speakers already talk about the platform issue, even on the same platform, how the things could be done, whether it's scaled up or not, how to scale it up. And on the issue of patent, this to be a thorny issue already. So to you, what is the key?
Well, simply waiving the patent rights is not the solution because nowadays the vaccine manufacturing, production, distribution are rather complex the issue. It's no longer a single company producing the entire vaccine. Basically, they have to procure all sorts of ingredients from different countries. If you simply waive the country without a proper arrangement, one of the potential problem is that everybody would try to purchase those ingredients and manufacture the so-called vaccines. Some may be underqualified. It may not be qualified for immunizing general populations. So there is a lot of issues here. You have quality controls and safety issues. So I think the proper way of doing that is that different countries, particularly industrialized countries, have to sit down and basically lay out in the plan and do an arrangement how to better distribute the vaccine. The production is an issue, but it's not the key as we have seen it. The key is that the wealthy countries procure most of the vaccines produced, and some of them are not used. That's the real problem. Actually, in a situation like India's pandemic crisis, I think there are a lot of ways, the industrialized countries could, lend a hand and help. I think the distribution is the key. That's why we need a COVAX. This is the platform WHO created to have an equitable distribution of vaccines. But so far, the COVAX has not achieved its goal in procuring sufficient vaccines.
It's very interesting, a situation that we're facing right now. There are only 3 panelists for this discussion, and you have very different opinions about what exactly is the key. Dr. Rani said it is the platform, that is the key. Dr. Tan said it is the patent, that is the key. And Dr. Wu said, well, it is the distribution, that is the key. See how complicated things are. But having said that, though, let me ask you about one crucial issue. I hate to say everything is political. Unfortunately now, it is very political, our world today. And therefore, export control becomes something that is not that far away from the reality that we're talking about. So to what extent do you think these politicians and political leaders, if they really want to commit to what they're talking about, need to do about the global system of supply chains and also cooperation based on supply chains earlier, and be able to deliver that? Dr. Rani.
So I am certainly not an international trade diplomat
But you
or
are a
supply
doctor.
chain expert.
Something close
But
to
I
your
am a
turf.
doctor and a
Yes.
public health professional.
Yeah.
Yes.
What is going to be
and
the
I can
call
say
from
that,
you?
both with the vaccines, right. So both with vaccines, just as we saw with personal protective equipment last spring, we've seen the way in which these international supply chains really determine the public health of the world. And we've seen the need for multilateral collaboration in order to facilitate that supply chain. And so I actually do agree with Dr. Wu that to a certain extent it is about production and about that chain from raw materials through getting them in factories, through getting them in arms. And to a certain extent, I think all three of us agree that that's what's needed. Pfizer is already producing 4 or 5 million doses a day. If those can be exported to low and middle income countries, and then we can provide the investment to get those in arms, that's what's needed. And I would love to see us come out of this pandemic and create a new version of supply chains in which we recognize that each of our stepping up to support each other's health helps us as well as others. There's talks about vaccine diplomacy, which I think is really important. Just as we had the Marshall Plan after World War II to help support the development of European countries that the United States invested in, similarly, we're seeing the US, China, and others now step up to support the public health of low and middle income countries. That helps them as well as us.
We hope that is the real support. I understand about the China story, Dr. Rani, that there are doses of vaccines being provided to the developing countries, particularly the least developed economies, such as those in Africa and Latin America. Dr. Wu, I do not want to finger point anyone, but it's very interesting that there are much more, several times of vaccines available, let's just say in the United States, than what the whole population could be able to have to use in the coming months, but yet are unwilling to export or provide to the developing country. We've heard a lot about talking about it by the politician. We haven't seen the actions yet. Dr. Wu, but the question is, will China's way of doing it and China's promise earlier delivered by Chinese President Xi Jinping be sustainable?
Yes, when I look at the data, actually, I think it's pretty sustainable, and basically China is trying to fulfill its promise. So far, about 40% of what the vaccine produced in China has been exported to other countries, and by either bilateral agreement or through the UN's WHO's COVAX program. So this is actually quite encouraging numbers. Of course, China, the pandemic new infection rates are at a very low, historically, it's extremely low. I mean, although we do have some kind of a sporadic bounce back, but this is something actually China has been doing. So I think as the pandemic situation in the United States and other countries are actually improving, diseases, new infections are under control. So I hope that they will be able to fulfill their international obligation and play a big country's role.
Well, one of the things is about vaccine. The other thing is about prevention and control, isn't it? Of course, vaccine plays a big role, but let's take a look at the latest situation when it comes to how this pandemic is spreading around now. The pandemic is still hitting the world hard. Here's a look at today's global COVID tally.
The latest Johns Hopkins University tally shows the world has more than 165 million confirmed COVID cases and more than 3 million pandemic deaths. The top 3 hardest hit countries are the U.S., with more than 33 million confirmed cases and 588,000 deaths. India, with more than 26 million confirmed cases and 291,000 deaths. And Brazil, with 15 million confirmed cases and 444,000 deaths. The tally also shows vaccine doses administered worldwide total more than 1.5 billion.
Sad number. We thought we could be able to control it within the year 2020. And then we thought about, well, maybe early 2021. And now we're already in the middle of it. And we're thinking, what about the end of 2021? And that is not necessarily going to be a promise. So Dr. Kim Kyung-tan, you and I were talking about that from the early beginning of 2020 last year. looking at the situation, what are we lacking in terms of prevention and control? Let's just put aside the vaccine thing, focusing on governance. Very briefly from you.
Well, you talked about the role of politicians. And I think a very important role of politicians right now is to be very honest about the short-term, mid-term, and long-term picture in terms of what will happen if we do not share doses, if we do not donate more funds into COVAX and make the WHO a more effective institution. The Independent Panel for Pandemic Preparedness and Response, they outlined steps that we could take to end this current pandemic and to prevent future pandemics from happening. They said, let's make this pandemic the last. And I think that reading through their recommendations, one by one, and really making them happen is the way to go. And in terms of governance, it's really about educating the public in terms of how we need to be committed to a global solution to this global problem. Because the negative effects, if we only think about our domestic issues, the negative effects will come back twofold, threefold, fourfold, and this pandemic will just extend even longer. And so I think making people understand that that is the reality, that we can't just say, I've been fully vaccinated and so now I'm okay, or the United States, we have enough doses so we are safe, that is simply not the reality of this pandemic. And I think we do need to open a lot of eyes and let people know. And once the public understands this, then the politicians will feel empowered to make those donations and to think outside of their borders and to think more globally and support the global cause. It just becomes very, I think, difficult for politicians to invest so much money outside of their, domestic pockets when people at home don't understand the need for that.
Crucial times, we all understand human nature, but it is also should be with human logic that we understand if others are not safe, we are not safe either. Dr. Rani, very briefly from you, governance issue, how it needs to be improved from a professional doctor's perspective, once again, briefly.
Yeah, so briefly, outside of vaccines, getting vaccines in arms, investing in those, both the procurement and distribution of vaccines, I also don't want us to forget about those non-pharmaceutical measures. So for people who have not been vaccinated yet, which is the majority of the world, the importance of masking, the importance of good ventilation cannot be overstated. And we can't forget about that because off of the previous commentator's point, just because we have parts of the world that are largely vaccinated, that doesn't remove the obligation for the rest of the world to keep trying to keep protective measures in place. And that's part of what happened in India, right? They removed those non-pharmaceutical interventions before they had an adequate percentage of their population vaccinated, and we've seen what happened. I don't want other countries to make that same mistake. And even here in the United States, it's important for us to remember that non-vaccinated people do need to continue to mask up in public.
Right. Dr. Wu, China is speeding up the domestic vaccination process. We still see a huge proportion of the population not yet. How do you see this process? Very briefly first, and then I go to the governance issue with you.
Well, actually, I think we're doing pretty good. Nowadays, it's about 10 million doses a day. So we're basically looking at in either October or November that about 1.2 billion population will be vaccinated. So that's about 80% of the population. And we hopefully by the time we will reach, achieve herd immunity. So that's pretty much our calculation. I think we are moving optimistically towards that goal.
But what about the governance issue? We have seen Chinese President Xi Jinping be able to share some of the best practices China had over the past 2 years with the colleagues at the Global Health Summit. We also see some of the commitment that he made on behalf of China this time as well. We are likely to see more discussion of that during the UN Health meeting, of course. Dr. Wu, how do you see, China's governance issue on this global pandemic? Do you see China could play more, shall we say, responsible role, which has already, if you look at the vaccines and things, what will be that role that you look at as a professional doctor?
I think China is playing quite an important role in fighting the pandemic globally, because China is one of the largest vaccine producers in the world. We right now we have about 3 billion doses per year production capacity. Although we haven't reached that full capacity right now, but currently I think we are something about 2 billion doses per year. So we're basically trying to ramp up the production to the full capacity. So once we have that capacity, that China will be able to distribute more vaccines to other needy countries. Mm-hmm. So that's what President Xi Jinping is talking about. Once we actually increase in the vaccination population, then we will be able to provide more vaccine to other parts of the world. So that's a very important contribution to the world community. I think this is something we have always been doing. I think this is what we call it, in the culture, that you have to work in a group to achieve a common good.
Yeah, we know what were the lessons coming from the last pandemic, right? 100 years ago almost. We know what needs to be done now collectively and individually as well. I think the only thing that we need now is that last mile, quote unquote. That is to really do it, and do it with responsibility. I hope that will be the wake-up call from this summit, and hopefully we're gonna have more real actions follow up. Thank you so much for the three of you, 3 professional doctors, really appreciate it. Wu Zhiwei, Alice King Kang Tan, Megan Rani, thank you so much.